There are a lot of common misconceptions out there, and they can actually lead to more harm than good. Now, there is some truth behind some of these myths, but certainly not all of them. And it's great to talk to your doctor about these myths because there are many, and they should be able to provide some truth to it, so you may not have to do certain things that you've heard about. One of those common misconceptions is that people need 8 hours of sleep every night. And certainly some people do. They may at some point in their life. You know, as infants, our babies sleep for long periods of time. They take naps every day. But as time goes by, we require less and less sleep. The average person, whether that be female or male, requires about 7 hours of sleep. Now, it doesn't necessarily have to be 7 hours every night, but if you get into a deficit, you may take a little while to catch back up. Now, some people get by on 6 hours a night. You know you have friends like that that do just great with that. However, there are people that you have friends that they require 8 to 10 hours of sleep. That's just who they are. Now, if you get to the point that you develop a sleep deprivation, where you have 4 or 5 nights in a row that you've lost sleep or you get less than 6 hours of sleep, you actually lose concentration, you lose focus, you're foggy during that last day. That's true. It's almost like you're intoxicated. You lose that level of function, so you do need to catch up. And that may come over a period of days, not just one day. Like for some of the myths, for instance, with exercising an hour every day, 5 days a week, that's daunting. Nobody's going to do that. Well, there are some people that do it, but it's going to be difficult to do. If you really get across that, hey, look, you only need to do 30 minutes a day, not every day. Try to get every other day at least, or get close to the 5 days a week. People are more likely to do that. And you don't start that way, certainly. If you don't exercise now, start 10 minutes a day. And, every couple weeks, bring that up just a little bit. And eventually you'll get there, and that's the best way to maintain your health. Build it into your activity levels. If you take 5 hours out of your week right now, that'd be very difficult to do for a lot of people because they just don't have that built in. I think there's a common misconception about switching from our current diets of whether that be hamburgers and fries and everything, cut it all out and we eat fruits and veggies for every meal. Not absolutely true. Certainly it changes based on who you are, what size you are, what age you are, all those things change. But for the normal healthy male or the normal healthy female, females need just a little bit less, but it's about 2 to 3 cups of vegetables a day and probably 1.5 to 2 cups of fruits every day. And that's really all you need. Well, if you think about a cup, think about it in your mind what a cup size looks like, and then a good sized apple, that's a cup. Pretty easy. So if you think about it, 2 apples a day, not so bad, but not necessarily 2 apples. You get an apple and an orange, or just mix it up a little bit. One of the other common misconceptions or myths out there for healthcare is that people require 8-ounce glasses of water every day. That's a lot of water. However, you don't. You really don't need that much for everybody. There are some people in some cases, if you have kidney stones or recurrent bladder infections, your doctor may suggest you drink a little extra water, but it may not even be that much. What they say you need is about 1 ounce for every 2 pounds of weight you have. Now, that still can sound like a lot, and you may add it up and think, well, that's still a lot of water. However, that counts everything. That counts the water in the hamburger you eat, the water in the celery, the water in the apple. By the end of the day, you may have most of your water just in the solid food that you eat. You may need just a little cup. And I'm not saying that's always true. Drink to your thirst. If you get thirsty, that's a good sign that, hey, you need a little bit of water or something, and it doesn't always have to be water. So one of those myths out there that you really don't need to follow. One of the things that we also think of here is that we think it's necessary and important that each individual seek out a primary care physician to establish that relationship, because we want to treat you when you're well, not just when you're sick. We want to know you when you're well. So when we do need to see you, we know everything about you. It's a heck of a lot easier, a lot more safe, and I think the quality's better. We're trying to extend our utilization of information technology so we take better care of folks. However, we don't think that's the most important thing. We certainly are going to utilize that information to provide good care for our patients, whether they be diabetic or have high blood pressure, or they just need their preventative care and their health maintenance issues addressed. We really think that we want to take care of the whole person. Again, I think that's key. It's what sets us apart. Is it going back to the basics? Yeah, we think it is. It's taking a step backwards and really trying to take care of the patient in not only just a timely manner, but take the time to see that patient, to wrap them up kind of here in their whole wellness needs, again, spirituality needs, healthcare needs, and nutrition needs, exercise needs. It's kind of the whole gamut that we want to be able to provide. I'm Greg Sweat. I'm one of the primary care physicians here at Shawnee Mission Medical Center.